Hello everyone, myself Dr. Stavin. I'm a gynecologist and obstetrician and also a done reproductive endocrinology and an infertility expert. Today I'm here to talk about infertility. Before we go into the further discussion, many times when couple approaches me for consultation, I see a big stress in their particular mind when I say they're infertile. Or they approach me because of some issues which is related to infertility. So I always address them. Don't think about the word infertility, but try to split it into two words. The first word will be the first two letters, and the other word will be the fertility itself. Now, if you look at both these words from a different perspective, then you can treat it like the fertility is inside me. That's where I always encourage them, don't get disheartened, don't get stressed because of infertility, because it is going to make the things more tough for them as well as for us as a doctor. That's why always think about this infertility as a fertility within yourself. So, based on this rough background, the things that I've highlighted for today's discussion are as follows. Before going into the topics, I have about almost more than 25 years of experience in this domain. So whatever particular things that I'm going to share in this presentation will be based on my clinical experiences. Many times what I've found is we follow more towards a bookish knowledge as a doctors, but we need to also gain our experiences from the clinical practice and try to imbibe it in a day-to-day life. So all my topics that I'm going to cover up today is totally based on my clinical experience. So the topics that I'm going to discuss today is I'm going to take you to the different phases of womanhood from the reproductive aspect. Next, we are going to see the adolescence age changes in a girl as well as boy. What is infertility when we call a particular woman or a man or a couple as such as infertile. Next, we are going to discuss fertility issues at all phases of womanhood. Now, basically, here in this presentation, I've tried to focus more on women. It doesn't mean that all the blame needs to be bared by women. There are equal chances that men can also be infertile. And also, I'm going to stress upon this point in the later stage. Further, we are going to discuss, is pregnancy possible in premenopausal phase? As of now, if you don't know what is the meaning of this, I am going to explain you shortly. And further down the line, we are also going to deal with how do we deal with infertility, which is more important, and what are the remedies to overcome it. So these are going to be the topics of the discussion for this particular session. Now, let's go into each topic in detail. The first topic is the phases of being woman. Now, I always like this particular picture that I see on the left hand side, and it indicates the woman in different phases of her womanhood, right? If you see the leftmost particular picture here, the leftmost thing, it is when a girl child is being born, when it start walking, when it start developing into a adolescence phase. And if you see this here, is might be a particular girl has passed the adolescence phase and has moved to the next stage. Here, if you see a particular pregnant woman, here, if you see a particular woman with the born child, and after that will be a particular stages of the aging. So, roughly, if you see, this covers up most of the phases of a womanhood, except the last one, that is the old age, or basically, in the technical term, from the reproductive aspect, we call it as a menopausal phase. Further, if you see also a diagram on the right hand side, you also see the phases of woman in her life cycle. of which the two things I would like to highlight is there are two colors that have been used to depict these phases. If you see, the first two particular small sections, they are in a gray color, and so does the last one, wherein the first two are a sort of adolescence phase in the woman, and the last one is the menopausal phase. But the middle three sections, if you see, they are in the red color. That is when the woman is ovulating, or that is when a woman's body is ready to conceive, and that is our challenge. So, our phase of infertility or a fertility is more applicable in this middle section, and it is less relevant in this first two sections and as well as in the last section. So throughout our discussion, we are going to focus on this middle section, which is highlighted in the red. To make the things more clear, let's go to the next slide. And this is again a wonderful picture that I see here. And I always appreciate this picture because it always shows the woman in a different phase, right from the born, right into the adolescence phase, right being a mother, and right being a grandmother. So what I've done is I roughly highlighted the different phases of woman from reproductive aspect into four stages. First one being adolescence phase. The number that are indicated here are roughly the age group. It is, based on my experience, I say it is from 7 to 14. But again, as I'm saying, there are no hard deadlines for this. It varies from topographical locations, and also the other parameters also comes into picture for varying the range. So adolescence phase is 7 to 14. Ovulation phase is from the age 14. It may also be extended to 16 as well. So plus and minus two variations are always there. 14 to 48 years. Further, there is a premenopausal phase, which is again from 40 to 50. And ultimately, the last one, that is the postmenopausal phase, is after 50 years. Now, again, make a note, the numbers that are indicated here represent the years, and there are no hard deadline for these particular years. There can be plus and minus 3 to 4 year variation possible from different places. So we are going to roughly speak about these four phases, and of our concern, the main phases that will be considered is the ovulation phase and to some extent premenopausal phase, because that is the particular phases wherein the fertility concept matters the most. Now, we are going to move now to the first girl chart, and we are going to discuss briefly what are the changes that you find in a girl as a girl approaches the adolescence phase. The first and the foremost change that is quite obvious is the girl starts to get pimples. A particular girl may complain to a particular her mother that I'm getting too many pimples. So you as a mother has to encourage her and tell her that these are common symptoms, and as her body is developing, these particular changes are being reflected and there is nothing wrong in that. She may also complain that some of her friends who are there in school, they are not facing the same problem. So there is nothing wrong in it. Different girls achieve the maturity at different ages. Second symptom that becomes quite obvious is the girl starts to sweat a lot. And you may find that a particular sweat might be little having a odor. Further, you will find that the girl may become little taller. Now, this is not always true. Some girls do not show a change in, as far as the height is concerned. Some particular girls get a tremendous amount of height growth in this particular phase. The next significant particular change that is found is definitely the growth of the breast. So definitely if you see from 7 age onwards, a significant amount of changes is observed as far as the shape of the breast and the size of the breast is concerned. So this is I would consider also as one of the major factors that is observed in the girl's adolescent phase. And further, there is also a growth of the pubic hair. With the starting of the pubic hair, the more prominent areas where it grows initially will be the underarm, and then subsequent you will find the particular growth at the vaginal area. And this particular growth will go on increasing as the age of the particular girl starts increasing. So these are some of the common particular symptoms which are observed in the girls in the adolescence phase. Further, this particular picture also indicates the same thing. Now, the thing that I would like to highlight from the leftmost two particular pictures is, if you see the first picture, this may be a particular girl who is 5 years old. And if you see the features, there are no significant changes that has occurred in this particular girl. There's no development of the breast, the vaginal area is almost same, and the body structure is almost flat. But now if we look at the second picture, this may be a girl who, let's say 15 years old. And now if you compare both these particular pictures, you find a significant change. The first and foremost change that you see is the enlargement of the breast. Second thing that you observe is the vaginal region is changing externally. Also, you will find her body is more curved. Apart from the external changes, there are a lot of internal changes that are also occurring inside a particular girl during this phase. But regarding the internal changes, we'll focus later on. We'll first focus on the external features. So the first particular feature, as I discussed before, is the change in the body shape, which is quite obvious and evident from here itself. Next particular change is the change in the breast. Now, many mothers, I would also request you to constantly monitor the change in the breast in your chart. So you may do a particular measurement, something like this, maybe once in 3 months or once in 6 months. But please do it. Third particular obvious change is a change in height. Now, as I told you before, this is not necessarily a parameter. Some girls may particular show a change in height. Some girls may not show a change in height. Fourth one, a girl may put on a weight. This is also a good indicator. Fifth one, as I said, is a girl may sweat a lot and the sweat might have the odor. Next one you will find is the girl's skin changes. Now the skin change we are referring to is having the acne or having the pimples. And the next one, there is a significant amount of change in the hair growth, also the pubic hair as well as the growth of the hair on the scalp. So these are some of the changes which are commonly observed in the girls in adolescence phase. And some girl may show all these changes or some girl may show some of it. But the thing that needs to be noted are the more evident particular factors like the growth of the breast and the change in the vaginal area needs to be considered in a more appropriate way and needs to be highlighted. In the next slide, again I have shown a wonderful journey of the womanhood. Now, whatever the things that we have discussed before are quite evident in this particular slide. So this is a newborn girl, this is a 2-year girl, a 5-year girl, wherein you might find not much difference between 2-year girl and a 5-year girl. Whereas now if you compare the 5-year girl with the 15-year girl, the changes are quite obvious in terms of the breast development and in terms of the development of the vaginal area, and so does the internal structure here as well. And further, if you go from 15 years to an adult woman, let's say of 25 years old, the changes are comparatively quite obvious, wherein at this age, the girl is more ready to bear a child. And if you observe the external features, she has a well-developed breast, a well-developed external vaginal area, as well as the internal organs are well developed, and it has taken a good body shape. So whatever the factors that were discussed before this are all incorporated in this particular single slide. So this is a wonderful journey that a woman undergoes. And of course, after the adult, there is an aging factor also. So one more slide could have been put up here. But as I told you before, our focus of intention will be more centric towards this particular age group. As such, I have tried to highlight this particular slide without considering the next or the last phase of the woman. Further, as I told you, the breast development is also a good indicator as far to know whether a particular changes that are occurring in a woman or in a girl in adolescence phase are obvious or not. As such, further has given a little bit stress on the breast development, wherein you will find here are the breasts maybe of a 1 year old or 2 year particular old child. In the stage 2, you may find a significant change in the breast. So this may be at the age of 10 or so. Further stage 3, maybe at the age of 15 or 18, you may further feel a significant amount of growth from this to this, from frontal view as well as from the side view. And stage 4 will incorporate a woman who is totally mature with a fully developed breast to bear a particular child. So this diagram explains the breast development in the different phases. Further, this particular diagram also indicates the same thing what we had discussed before is if you observe a 5 year particular old girl, there are no significant changes in the vaginal area as well as the breast. This may be a 15-year girl wherein a significant amount of changes are observed in the breast and also the vaginal area. This may be 25 years old, still she is improving. And further down the line, this may be a fully adolescent girl, a fully particular grown-up girl, wherein the breast is completely developed and also the vaginal area externally as well as internally is well developed. This is from the external point of view. And here if you observe, you will also observe a significant change in the breast development. Now, when it comes to internal structure, we are dealing with a ovary and the uterus and some other parts which will incorporate the internal reproductive system of a woman. Now, in terms of the ovary, if we see, as the woman grows, the size of the ovary also grows from less than 1 cubic centimeter because the ovary always treated in terms of volume. It goes to 3, it goes to 5, it goes to 7, and ultimately to 10. Now, these are not hard-coded numbers. In some women, it may lie in this particular range, and that is absolutely normal. So does there is also change in the uterus from 3 centimeter, 3.75 centimeter, 4.5, 4.5 to 6.7 to 7 particular centimeter. Of course, again, these are not hard-coded numbers. Some variations are observed also, and they are quite normal. So nothing to worry if you see your numbers slightly shooting up this particular range or below this particular range. But roughly, based on my particular experience, I have put up these particular numbers. So, having discussed the structure that a woman goes through in the adolescence phase, I will now shift over my discussion to the boys, and we will see also now what are the changes that occurs in the boys in this phase. The first and the foremost particular change that is observed in the boy is the voice. There's a change in voice, or voice deepens, what we basically call. The next one is the height. So there's, to some extent, or in majority of the part, the boys tends to gain a height. In terms of face, the boys will also have the pimples. In terms of the sweat, it is also observed in terms of the boys. And also, the hair growth is more prominent in the boys in terms of hair in the underarm, hairs on the face that we basically deal with the mustache and the beard. Next, you may find also the hair on the chest, on a particular stomach area, and obviously in during the at the penile particular region. So these are the changes which are quite obvious in boys in the adolescence phase. Unlike the girls, of course, the changes in the particular boys are very much limited, and the prominent one is the voice change, the particular height change, and the change in the penis and the testicle. So basically, if we see, there is an increase in the size of the penis as well as testicles as the age of the particular boy grows. Next thing, since the only involvement of the particular part that is involved in the boys is the penis and the testes, and of course, these are the sexual particular organs in the men, and they are externally available for examination. I have put up this particular slide also to focus on this particular problem. So whenever any particular man approaches to me with the infertility particular problem, then the first examination that I also do is the testis examination before redirecting him to do any particular test. Also, when a particular any adolescence particular boy also approaches me along with the parents, I also do this particular test and also teach the particular parents how to do it in a controlled fashion, and they can also do it at home but under a controlled supervision. So first, you need to get the particular shaft of the particular penis on top and slowly particular move the scrotal area in a forward and backward direction and check if there is any lump. You can also move this particular scrotal area in upward and downward direction, and also try to push the scrotal on the one side and try to see the symmetrical cord. Now parent may not be aware of how to check in this, but I can advise you to carry out this examination after a particular boy has taken a shower or after he has taken a bath. And whenever you are doing this particular procedure, always ask the particular boy is whether he's feeling a pain. And anytime if he feels a pain, you need to stop it and immediately get him to the doctor. Of course, don't try to press the particular scrotal area. You are supposed to just try to move it in a forward and backward direction and try to check if there is any lump. So these are the examinations which a boy or a man also as well can do at home, and which may also call it as a self-examination. And if there is any particular pain, you need to immediately report to the doctor. Having discussed this, next is the picture which I have shown is of a particular woman, of a man who is maybe 18 years age. Now, this is the only organ that is available externally in terms of a man. And if you see here, the particular penis shaft is almost developing. The scrotal area is also developing. And in terms of the hair growth, we say there is a substantial amount of hair growth, although it's not full-fledged, but definitely a substantial amount of the hair growth is there. So in terms of pubic hair, it's slightly curly, dark, coarse, and spread sparsely. And this can be treated as the tenor stage of pubic hair, P3. Now there are 5 stages altogether in terms of the hair growth, and at this particular phase, it may be a P3 phase, whereas P1 and P2 basically comes in the adolescence phase, P3 comes in this stage, and P4 and P5 in the higher up stage. So out of this, I put up this picture to show the external reproductive organ in a man, and in terms of hair growth, it has come as P3. Having discussed now the particular changes that occurs in a man and woman in the adolescence phase, I would like to summarize both of these together and why these particular changes basically occur. Now, what triggers all these changes are the hormones that are produced in our body, which is ultimately responsible for the development of all the particular parts and to carry out the respective function. Now, here I highlighted a woman, here I highlighted a man. So some of them may have the common glands and they may be generating some common hormones. Whereas there are some hormones which are more specific to a woman and there are some hormones which are more specific to men. So I'm going to roughly highlight here the different particular organs which generate this hormone, and basically we call them as our endocrine system or endocrine glands, which are responsible for generating the hormones which ultimately controls the different structure and functionality in men as well as the women. So first and foremost, we have a pituitary gland which releases the hormone that stimulates the following functionalities. Now, if you observe, the pituitary glands are located in men as well as women. So let's go one by one. Further next down the line, you'll see here there are adrenal glands, which are also common in both of them, and they're also responsible for generating the hormones, which ultimately stimulates the following functionality in women and the following functionality in the men. Further, this pituitary glands also stimulates the hormones for the ovaries in case of the woman and testes in case of the man. So let us now focus on the woman aspect first and then come back to the men. So further, if you see here, what are the things that are responsible and brings about a change in a woman because of this hormone? All these particular changes we already discussed before, like the underarm hair growth, the breast development is also controlled by one hormone, prolactin. Further, enlargement of the uterus. Now, as I told you, what we have seen before was only the external growth in a woman, but I had mentioned that internally also a similar changes happens, and one of the change is the enlargement of the uterus as the woman's age increases. That is, her body is now preparing herself to conceive. The next foremost particular change that also occurs in women in adolescence phase is the beginning of the menstruation, that is, the menses. And of course, the growth of the pubic hair is quite obvious, and we have discussed it also before, that is also controlled because of this hormone. Now, what are the things that happens in men? The things that happens in men is the facial and underarm hair growth. As I talked before, these are also a common characteristics observed only in men and not in women. Of course, in women we do have a particular hair growth in underarm, but definitely we don't have a facial hair. The next significant change in a man is a larynx enlargement, and which is responsible for a voice change, and that is quite obvious in a man rather than a woman. Third is the growth of the pubic hair, not only at the penile area, but also all over the body, and it is more obvious in a man rather than in women. Further down the line is the growth of the penis and the testis. And as the penis and testis is growing, a man may also encounter something called as the ejaculation or a night discharge. So, you as a parent, if a particular boy finds himself discomfort after getting up early in the morning and trying to find out that there is some discharge in his underwear, then you as a parent should always tell him that these are the common particular symptoms observed as is moving from a boy to a man. And these are quite obvious because the size of the penis and testis is increasing at this particular level. So, a sort of a sexual feeling is also developed in the mindset of a particular boy, and ultimately at night, discharge is one of the particular aspects related to it. He may not do it intentionally, but it may happen unintentionally, for which he may feel regretted. So you as a parent needs to encourage him and tell him that this is normal. Similarly, a girl may also observe some sort of a discharge from the vagina before the start of the particular first menses. So you as a mother has to also tell a particular girl these are a common symptoms that you are developing from a girl to a woman. So all these particular symptoms are quite common, and there's nothing to worry about or to take a stress. Further, I also, for your reference, have indicated the external body changes that happens in a man and woman. Now, always in my presentation, I always try to represent it by using a live particular pictures like this, so it becomes easier to understand rather than showing the pictorial representations in terms of the non-body existence. So if you see here, the first particular picture that you see, I would like you to compare one by one here. So this may be a particular girl who is in adolescence phase, and this may be a boy in adolescence phase. This may be a particular age group of say 18 years, when if you see a breast is developed substantially, her internal organs is developing, her body is taking a shape, her vaginal area is also growing. In case of the men, if you see, the shaft of the penis have increased, the scrotal area size have also increased, and he has become more masculine. Further down the line, stage 4 may be a particular woman of age, say 25, wherein it is quite obvious that she has a fully developed breast, fully developed vaginal area, the internal structure, and if you compare it with a man, definitely his penis is enlarged and the scrotal area is also well developed. So this is a particular phase wherein both are ready to conceive. This is further one more picture which indicates the next phase in a woman, that is the ovulation phase. So by now, whatever we discussed, we are focused on the man and the woman, or a boy and a girl aspect from the adolescence phase. And now we are going to focus on man and woman in the ovulation phase. So obviously, by the time you reach here, your penis in case of the man is fully developed. Your vagina in case of the woman externally and internally is also well developed. And if you now observe the body particular features in men and women, they are all what we discussed before. Now, having discussed more of the external body features, now I would like to go a little bit into the inside reproductive system of the man and woman. So let us first particular focus on the men. I'm going to briefly explain you about this particular phase. So if you see in a particular man, this is the penis that you see here. Further, this is the scrotal area. You have epididymis here, you have a testis here, and the scrotal sac over here. Further, if you see, there is a particular duct that goes here, and it ultimately travels from the outer region of your urinary bladder, goes inside, and tries to come out here. So this particular area that you see are the prostate glands. And basically, we call this as the ejaculatory duct, which is responsible for carrying the seminal fluid from here. And as your seminal fluid moves down the line from this particular duct, some other additional components gets also added up to it. And ultimately, if you see from here, it comes down here where now this particular portion is very critical, wherein you have a duct coming down here, what we discussed, and you have one more duct that comes down here from your urinary bladder, from where you are going to pass the urine. So this is like the intersection point. And ultimately after that, it is a single passage or a single duct that carries either a urine or your seminal fluid down the line until it is ejaculated. So there are chances that in a particular man, many a times this particular duct may be blocked at this particular point. And there might be many infections also possible. Other particular areas where you can find blockage in the duct if there is an enlargement of the prostate. So if the prostate enlarges, it constrains the movement of the flow in the duct, and as such, you cannot pass urine, you cannot pass seminal fluid as well. So when we deal with the infertility in a man, there could be many reasons associated with it, because if you see the passage that the semen and seminal fluid flows through, it comes from here it has to move down the line here, and then it gets a mixture of two more parts, that is reticulatory ducts, seminal vesicles, and where the additional components gets added up till it goes through this particular line and ultimately ejaculate. So when we deal with the man infertility, there are many aspects that also needs to be taken care of. It is not just the erectile dysfunction, but the problem may lie somewhere here, or the problem may also lie somewhere here in the intermediate parts, or the problem may also lie due to the blockage of this duct. Whereas, in case of the female reproductive system, if you observe, although the area looks very small, but it is equally complicated. Now, one good thing that has happened in a female is they have a separate opening for passing the urine. So unlike in a man where there was internally a sort of a junction wherein both these ducts were joining together and then going through a common duct, that doesn't happen in case of the female. If you see here, this is the particular urinal opening. This is the urinary bladder, and these are the kidneys which are ultimately passing the urine to the bladder, and from the bladder it comes out. Whereas the other opening, we have a separate opening called as a vulva that is linked to the reproductive aspect of the womb. Now, what are the areas in terms of the internal structure of a woman is you will find a vagina, that is the immediately what you see the passage after this external opening is a vagina. Further, you will have a cervix. So most of the time this is closed, and only once in a month it draws the opening to pass on your menses blood. Or a more obvious change of the opening is seen when you're delivering a baby. Otherwise, most of the time, it is the tight muscles which are in a closed position. Further down the line, you have a uterine lining. So this is your uterus, and outside what you see is a uterine lining. Further, you have these ovaries, which are shown in red, and you have a fallopian duct, or also called as a oviduct. So basically, the woman's internal reproductive system will comprise of, I would say, is the uterus, the fallopian tube, the ovaries, right? So these are the major part that is a contributing factor in the reproductive aspect of a female. Further is, having discussed the male and the female reproductive aspect, this picture conveys a lot of information in terms of the woman. As I told you, this particular presentation is more centric towards the woman. So if you see the rightmost picture, a woman is holding a clock. But what goes in her mind is very important to be studied. She is always analyzing the time when she will be able to conceive. Any woman, the first particular thing that comes in her mind is when I got married, when I'll be able to conceive. And this is typically a scenario wherein this particular woman has failed to conceive and she's holding a particular clock and saying, when will my time come wherein I'll be able to conceive and bear a child? On the other pictures that you see is the woman, if you see the topmost picture, the woman is trying to do a pregnancy test. Might be she was in intimacy with a partner and now she's testing. This is a woman who is analyzing the test. And if you see in this particular case, the woman has failed a pregnancy test, and that's why you see her crying. The reason behind putting up this slide is when many of the women who are going to watch this presentation, definitely you are going through these particular phases at some point of time in your life. And the most important point that I would like to highlight is don't get discouraged because of this slide. Pass or failing a particular test once, failing a test twice or 10 times doesn't mean that you are infertile. That's what I always address my particular patients is try to have patience. I tell my patients to have a patience and give enough time to your body to heal, and let your particular body itself tell you when it is ready to conceive. So don't push your body, let the body itself tell you when you are particularly ready to conceive. Now, coming to the topic of infertility. There are various definitions for infertility, but the most common that has been followed is when you can say a couple or when you can say a woman as an infertile. Now, the obvious definition that has come up is after their particular marriage, if you are not able to conceive within a first year of marriage, provided they are not using any sort of contraceptive, then we can say there is some sort of infertility that exists in those particular couple. Now, this is with the assumption that they are planning for a particular child and they are not able to conceive within their first year of marriage. Now, still, based on my experience, I would rather not stick to 1 year, but I would extend it to 2 years. But you, as a doctor, many of you who are watching this particular presentation will go by the bookish knowledge, which says 1 year. But according to me, there could be various reasons why this time factor can be extended. And some of the reasons why it also doesn't happen within a time frame of 1 year, I also tried to highlight here. The first and foremost is if a woman had a history of irregular periods. That means, let me also focus here little bit on what do you mean by regular periods and what do you mean by irregular periods. So we say irregular period or irregular menses is a menses which doesn't occur within a 28 days to a maximum of 32 days or 35 days. So if you are getting your menses outside this particular window, the menses becomes irregular. Whereas if you get a particular menses within this particular window of 28 days to 35 days maximum cycle, then the menses can be treated as a regular menses. Now, what are the things that happens during the menses? One of the important thing what happens in the menses is in the first phase, what we call it as a follicle phase, is the eggs are produced in the ovary of a woman. Next phase is the ovulation where the egg gets released. And the third luteal phase wherein the egg tries to have a particular place in the uterus. Now, if at that particular point of time, that is in the third phase, luteal phase, if it doesn't come in contact with the sperm, or in the second phase of ovulation, if it doesn't come in contact with the sperm, then all the preparation that a uterus has done to bear a pregnancy needs to be shedded away. And that's how you get your periods. Or that's how in a woman, a blood comes out from the vaginal opening. That is nothing but the shedding of the internal lining of the uterus because the egg that was produced could not be fertilized. Now, coming back to irregular periods is when the time frame of this particular period is not finalized, we do not come across the exact date of ovulation. So that's what causes a problem is when to have the intimacy with your partner in order to conceive. For example, in case of a regular period, if your period cycle is of 28 days, we basically say your ovulation may be from the 12th day from the start of your last period. That is the time usually when the egg will be released, and we usually recommend the couples to have the intimacy egg from the day 12 onwards till day 17. And there are chances that they may conceive provided all the other parameters are normal. But when? So usually when in case of a normal period of 28 day cycle, the day 12 till 17 may be considered as the ovulation phase. But when a woman has an irregular period, we don't know when her ovulation may occur. some women may get a particular period after 40 days. Some may get after 2 months. Some may get after 3 months. So if that is the case, then we don't know when is the actual time the ovulation is occurring in that woman. And in some cases, the ovulation window may also be very small. So the challenges that are faced in case of irregular periods is trying to identify the correct ovulation time. That is critical if you are looking for conceiving. Now, this is one of the reasons, and I'm also going to prepare one more particular slide show somewhere in the later stage related to this particular issue. Next common factor that is also found is poor quality sperm that has to deal with the men. As I said before, we are not putting the entire blame on a woman, but equally based on my experience, I found that the men also shows infertility. Wherein, if there is a poor quality of the sperm, now when I say a poor quality, the two aspects that also needs to be considered is the sperm count and also the motility factor. Motility deals with how a sperm can move from particular inside the woman area to fertilize a particular egg. The next particular factor that I observe is the stress. Now, the stress plays a very important role in creating infertility. As I told you before, you see the glands are present in your particular brain and they are responsible for sending the signals to the different endocrine glands to generate the hormones. But whenever you are having a particular stress, it suppresses the generation of these particular signals, and as such, your entire endocrine system doesn't work properly, and which ultimately results in infertility. Now, there could be different types of stress in different kinds of people. It might be the stress related to the work, stress related to the family, stress related to your new environment. And this is quite obvious in a particular girl who is married and shifted to a new environment, and we are looking for her to conceive within a time frame of 1 year. That's why, as I told you before, although this is based on the bookish knowledge, I still would like to extend this particular time. So many girls finds it little bit difficult in the initial phase to adjust to the new environment, and that also may result in generation of the stress, and it is affecting her entire endocrine system. Other particular reasons which I also come across is the career commitment, wherein a girl is committed to first establish a career. As such, they try to prefer to take some contraceptives, and once their career is established, they almost reach the age of 35 plus, and that time they try to have a particular baby. Now, due to the intake of the contraceptives, there are different modes of having a contraceptive. I will not go into the details of it, but it is also observed that it also affects their fertility parameters to some extent. So any delayed particular pregnancy is always to some extent decreasing your chances of conceiving. And it also opens the particular doors for other related problems to in terms of the woman. Other particular factor that also I have come across is the past trauma. Some women might have had a particular sex prior to having a sex with a husband. And there was some particular trauma that were also related to that. Might be in terms of the abuse, or might be some woman had some particular child done child abuse. So those kind of particular things creates a sort of a trauma or sort of a fear in the mindset of the woman, and she simply tries to neglect the sex. So that can also create one of the reason behind this kind of infertility. Further, I have listed down here the possible causes of infertility in women. The first and foremost, as I told you, is the age factor. So some couples may give a priority to their particular profession, and may use some contraceptive ways to delay a pregnancy. Or in some women, they married itself at a later age. As such, they find it difficult to conceive. So age is also one factor. Next common particular factor that I have found out is a polycystic ovary syndrome, or we basically call it as a PCOS. Now, this is again a vast topic, but I will just brief you about this syndrome. I also found a particular girl who is as young as a 16-year with this particular syndrome. On the other hand, I also found a particular woman who is at the age of 35, 36, or even at the age of 50 with this particular syndrome. So there is a wide range of a woman age concerned with this particular disease. So what happens in this polycystic ovary syndrome is, as I told you, the menses cycle is comprising of the four phases, and the first phase is the follicle phase, wherein there is a development of the egg. So in this particular, in this kind of a disease, what happens, it generates multiple follicles in your ovary. And as it is generating a multiple follicles, they are not mature enough to produce a healthy egg, because ultimately these follicles has to be converted into a sort of a egg. In here, you are generating a multiple follicles, and as such, none of them becomes good enough to form a good matured egg for conceiving. So this is one of the common reasons that I also found in many patients. Next particular reason is endometriosis. Now in endometriosis, what happens is there is a growth of a tissue, additional unwanted tissue, we basically call it in simple terms, across the different portions, like it might be at the ovary region, it might be on the fallopian duct or fallopian tube, or also it might be in the uterine lining. So endometriosis is basically dealing with the growth of the additional tissues at the various regions where it was not supposed to be. And that may also affect the fertility in women. The next one is hormonal imbalances. As we have seen before, there is a need for all these hormones to be in a balanced ratio for a proper functioning of your menses and the menstrual cycle. But if, because of some reasons, if there is an imbalance that has been created, then the entire particular cycle gets disturbed. The next one can be uterine factors. These are related to the fibroids that can be generated or that are developed inside the uterus, and that prevents you to some extent the particular the conceiving process. Also, there can be also reason like we have a cyst, like in a polycystic ovary, there is a growth of the cyst in the ovary that also prevents the generation of a healthy egg. Whereas these uterine factors is basically deal with the fibroids which are generated in the uterus, and that is preventing the fused particular sperm and egg, which is basically called the zygote, to be structured or to hold properly on the walls of uterine lining. Next one, we may have altogether fallopian tube blockage. So if you remember, I told you the egg has to traverse from the ovary and it goes through the duct in the female till it reaches the uterus. So the middle portion that was there was the fallopian tube. And if there is any blockage, then the egg will now be able to reach uterus. As such, the conceiving part, I mean the fertilization part will never occur. As such, and there are various reasons also for this particular blockages, and one of the reasons, as I cited out, could be endometriosis. Next one, we can have ovulation problem. Now, I already discussed what is ovulation, and if you have irregular menses, identifying the ovulation day becomes a critical challenge, and those problems are related to ovulation problems. Further, you can have also the complications from the past childhood. Now, these are the cases when the girl, woman already had one particular birth and given a one birth and wants to conceive for the next particular time. But because of the some of the complications that arise in the past, then it becomes unable for her to conceive for the second time. Sometimes the other particular reasons also associated is sometimes we try to remove some one of the ovaries because of some problems, and in that particular case, the woman is only left with one ovary to produce the egg and to fertilize it with a particular sperm to conceive. Next one, a recurrent miscarriages. So, in this, although a particular egg and sperm is fusing, but the particular thing that is fused may not last for long in the uterus, and as such, the miscarriages can occur. So, there are many particular reasons also associated with the miscarriages, which I will not go into details as of now, but this could also be a reason of recurrent miscarriages may also result in infertility because although they are conceived, but it cannot be grown into a healthy baby, and ultimately they are not able to fit the window that we have defined to have a baby, and as such they can be classified as infertile couple. Next important particular factor is also called as a egg reserve. Now, as the age of the particular woman increases, definitely the egg reserves goes down. Egg reserve basically deals with how many eggs a particular woman can produce in her one menses cycle. So if you are in an age group of say 20 to 35, definitely your egg reserves is in good quantity. Or I would say from 20 to 30, it is the best ideal age to go for a child. It doesn't mean you cannot conceive after 30, but definitely as the age increases, the other problems also starts to come up. The next one is what is most commonly particular observed is eating disorders. And nowadays, we as a particular woman or also as a man, we have accustomed to a lot of the junk foods, unhealthy foods, which is to some extent is contributing our endocrine system functioning. And as such, I also observed that the eating disorder is contributing sort of a major particular factor towards the infertility in women as well as a man. So although I given a stress here in terms of a woman because this particular presentation was more towards a woman-centric problem, but it doesn't mean that the infertility doesn't occur in men, as I told you before. It can also occur in men and they can also have a similar list of the problems. Now, to give you a rough particular idea about what might be the cause of infertility in men, the first and foremost is the structural defect in the sperm. The structure of the sperm itself is not in a proper form that can result in male being infertile. Although his partner, female, might be fertile, but since his sperm is not of a proper shape, it cannot fuse with the egg that is produced and it may not result in conceiving. Next one is the obstruction in the genital tract. Now, as I told you before, the particular tract has to pass through a lot of particular organs, and ultimately there is a junction wherein also a urine also comes, and then ultimately it travels through the penis till it is been ejaculated out. So there might be also the obstructions in this particular tract which prevents the sperm that is being released to be ejaculated. Now there are different reasons for obstruction. One of the reasons, as I cited out, could be the infection. Other particular reason also could be enlargement of the prostate, which results in the blockage of that particular path because basically the duct passes through the particular prostate being on both the sides. So if any enlargement in the prostate takes place, the particular duct gets compressed and it prevents the particular and it creates so basically sort of a blockage. Or the other reasons could be also infection or non-functioning of one of the particular parts. Next particular factor is the volume of the semen that is being produced. So many times it has been also observed that a volume of the semen that is being produced in a man is comparatively low. And that is also one of the reasons of infertility. The next one is the mobility of the sperm. Rather than the volume, I would give more importance to the mobility. At times, it is observed you have enough volume, but whatever the sperm that are produced, they are immobile. They cannot traverse a far distance. Although the distance is only 5 particular centimeter to 10 centimeter, but for sperm, it is equivalent to, say, walking or particular running rather, say 1000 kilometers. So from the sperm perspective, the distance is very huge. From our perspective, it may be hardly 5 to 10 centimeters. The next particular problem that is encountered is also erectile dysfunction. Now, wherein a particular male doesn't get enough erection also during the penetration egg and may ultimately fail to release a particular sperm into the vagina of the woman. Now, there are many various reasons associated with it, but the most common that I have found is an excess amount of the masturbation. Now, I would like to focus a little bit also on the masturbation at this particular point of time. Many a times I have come across many couples, and after interacting with them, I also found out that they have started masturbating, men as well as women, in a quite early in their particular age. Now, I'm not saying the masturbation is wrong, although some of the religion or some of the books may say it, but from my practice, I would say masturbation is good provided it is done within a limit. Anything that is done in excess is always harmful. As such, if a particular man or a woman in her adolescence phase feels a sexual desire, and it is quite common to have these sexual desires because that whole endocrine system is being developing in this particular age, and definitely they will feel attracted towards one another. I always tell my particular patients, even if they come in adolescence phase, is you can release that particular desire through masturbation rather than physically getting in touch with one another and creating the complications like unwanted pregnancy and so on. But there is a writer to it. You can do it, say, to a safe level of 3 to 4 times in a week. 3 to 4 times in a week and not in a day. Whereas many of the infertile couples that had come to me, either both the partners or one of them, I observed, have started the masturbation at the early age, and also the frequency of the masturbation is drastically increased. And that is one of the particular reasons that can also result in an erectile dysfunction in a man, and also it can also relate to a problem related to the volume of the semen. Because to tell you frankly, to produce this particular semen, your body has to go through a lot of working inside. So like a particular female endocrine system, the male also has an endocrine system to release the hormones, and those particular hormones are also responsible for generation of the semen. And if you just waste it by ejaculating it, say 6 or 7 times a day, then definitely over a long period of time, it is going to affect your volume. It will also affect the motility, and definitely the most critical aspect, it may result in erectile dysfunction. This is one of the reasons of erectile dysfunction. There are also others which I will not try to focus at this particular point of time. Next thing is this homocentric towards the woman and the challenges. Is the pregnancy possible in menopausal phase? Now, when I say menopausal phase, I am dealing with the age group of, say, 40 to 50 years. So, is pregnancy possible in this particular phase? Definitely, you as a doctor, I would always say yes. And it is my bound responsibility to help the couples, no matter when they come, and no matter whether it is permissible within the preview of the structure of the anatomy, definitely we should do our best to help the couples to conceive. And I would be very happy to share one experience with you all that in my practice, I was still able to conceive a particular woman at the age of 52. And she could conceive naturally and could also deliver naturally. So nothing is impossible over here. You need to have a patience and you need to have a good interaction and trust and faith with your particular patient so that the things can be worked out quite easily. So we'll see this scenario is a woman approaches to you in a premenopausal phase. And this is one case wherein a woman already had a pregnancy in her ovulation phase and she wants to conceive now again in premenopausal phase. That means a woman already have one child in, let's say, the ovulation phase, what we had defined before, and after a gap of say 6-7 years, or maybe also less than that, they plan for the next particular child. But by now, the woman has crossed the age limit of 40 and she is now in the window of premenopausal phase. So the question that needs to be addressed at this level is, how will my body react? Now, treat each pregnancy as a new episode. You have successfully conceived before doesn't mean that you can successfully conceive now, because each episode is different. The things or the parameters that were there during that pregnancy were different in terms of your age factor and the other factors. So the factors will change now. So each particular pregnancy needs to be treated as a new episode. You need to identify all those parameters to judge how your body will react to this new episode of new pregnancy. And mind you, now you are in premenopausal phase. Will it be same like before? Definitely, my question is no, because the parameters have changed, but I would not say it is not possible. It may be also same like before, but we cannot directly say yes until and unless we carry out all the particular tests and the examination, because the parameters have changed. As such, a thorough examination again is a must, and we cannot simply rule out from the past experience. So first and foremost, the common test that is suggested is AMH test, that is anti-malignant hormone test, that basically gives you a rough indication regarding the production of the egg by a woman. So if this test gives a good result, that means we know that this particular woman is still producing good healthy egg and she has a good chances of conceiving, provided her partner doesn't have any problem related to the fertility. The next case that we come across is a woman who has failed to conceive in ovulation phase and trying to conceive in a premenopausal phase. As the reason cited out before, this case may come across because for some women, the career was a commitment, or some women have married itself late. As such, they could not conceive in our ovulation phase, which is basically a peak phase to conceive, but now has landed up in a premenopausal phase wherein they want to again have a baby. Will I be able to go through this pregnancy at this stage of my life? Definitely my answer to the patient is yes. And we are doing our best to help our patients. So I have listed some of the parameters that you need to take into account. Now, these are not only the final ones. Of course, there are many tests that also needs to be done, but I have tried to highlight the simple ones from the doctor perspective. So first and foremost, from the doctor perspective, and also from the perspective of the patient to know roughly why these tests are important and why the doctor is asking me about it. So this presentation was also more friendly for the patients as well as for the doctors. So first and foremost, you need to go for AMH test. AMH test at this stage becomes more evident compared to this, but as we know, it is a must in both the cases. What it does, I already explained you. The next point that we are going to deal with is the heredity. Now, this is very important. You need to ask this particular woman at what age her mother or maybe the relatives from her particular parent side have achieved a menopause. If she approaches, suppose, at the age of 42 or 45, and she says that my mother had got the menopause at the age of 48, then you know you have a very less amount of window to work with. It is most likely that she may also get a menopause around that particular area, may not be at the same age. So getting the hereditary information at this particular point becomes a critical factor in deciding roughly how much window do you have and to what extent you can play around that particular couple and make them conceive naturally. Third one, is my body ready to accept my decision to conceive? This is again a very important question. A couple or a woman may have the willingness to conceive, but what is also more important is her body should support her decision for conceiving at that particular age. And that's where checking the statistical particular points or the markers we basically call in terms of the different tests becomes a critical point. And that's why I recommend you to have a thorough examination first with a physical checkup of the body, and then you can go with some test if it is required. In my case, I have a thorough examination of the patients, and from the different parts of the particular body, I could roughly gain an idea about the endocrine system. And then if required, I tell them to do a particular test in the lab. But you as the new doctors, I would recommend you to tell them to do the tests that are being required, and based on the result, you can take up your decision. Now, this is a slide that I've purposely put up dealing with the statistics of infertility. Now, the things that I would like to highlight first of all is based on our research that we have done in the particular lab, as well as based on the clinical experiences, what we have found that in basically in Australia is when are the particular months which are more ideal to conceive. And we have found that in November, December, October is the ideal time when many of our patients are able to conceive without taking much of the support of the medicine. And further down this line, if you observe the months like the August, September, June, March, definitely the success rate is also comparatively high, but it is still lower than this previous month. And down the line, that is in May, July, April, and so on, it drastically decreases. This is based on, again, what we observe is the weather pattern, and based on the leisurely time the couples can spend with one another. But from the medical perspective, what we have found is these are the particular months wherein the temperature is found to be very high. We had done this study not only in Australia, but we had done it also with respect to the New Zealand and also some couples from the UK and also from the Asian regions. So basically what has been observed is whenever the temperature shoots up, definitely it to some extent affects the fertility in a man. That is, although the production of the particular semen will be very high, but it affects the motility of the sperm. And as such, ultimately, although the female is fertile, but the couple could not conceive because there is some sort of the motility factor that also comes into picture because of the increase in the temperature. For different countries, this particular graph may change. I just highlighted it to give you a fair bit of idea how the nature also plays a role in our fertility. So definitely a particular area wherein there is a higher temperature, definitely we find that the infertility in a man is increased because of these factors. Further, in this particular slide, it's a time to conceive. Now, as I was focusing on, is we also found out that a particular couples in a 1 month of their marriage, only about 29% of chances are there of them conceiving. Now, this is a case wherein we have found that a woman was knowing the family of the particular man well in advance, It is sort of a love marriage rather than some of the arranged marriages that I've seen in other countries. But in Australia, and almost of them are love marriage. So a woman knows the family of the man well in advance. So the stress that was created because of the environmental pressure doesn't exist much here. And many a times the couple prefer to stay separately. So as such, we have also seen that in a 1 month, around 29% chances are there of them conceiving, which is still very less over the overall period. Further down the line, in the 3 months, we have found around 40%. In 6 months, 79. And in 12 months, we have found about 85%. So definitely given a higher window, as I suggested, more than 1 year, definitely this percentage will go up. So this is a usual trend found that very less amount of particular couples can conceive in their first month, and whatever the ratio that we have got is based on the particular area wherein they either live separately or a particular girl was well versed with the family of the men, etc. She could not get that stress of the change in environment. The other thing that I would like to also highlight, which I had stressed before, is many times, if you see, most of the women who are in the less than 35 age can conceive easily. Between 35 to 39, if you see, this red line increases. 40 to 45 still less, and greater than 45, you are relieving your chances to narrow. So pregnancy rates in female are found in these particular variations across the globe. Now there are various reasons also pertaining to the infertility, and one more thing that I would like to highlight is fertility by age. So if you are in the age group of 20 to 24, definitely you have around 86% chances of you being fertile. We move to 25 to 28, it gets reduced to 70. And as if you see in this graph, as the age increases, your fertility chances are becoming lower and lower. And it drops down to nearly 1% when you are 50 plus. So, as I'm telling, try to conceive at an earlier age if it is possible, and try to prevent a delayed pregnancy. It is not only just related to the pregnancy aspect of it, but also the other woman particular health issues may also crop up if you delay in a pregnancy. Now, one more particular slide is this, wherein what is infertility, which I already explained you. And definitely if the woman or if the couple are in the range of less than 35 years, we basically give them 1 year time to check if they can conceive. But again, I had contradicted that particular 1 year and I've slightly increased my window to say 1.5 to 2 years based on case to case. Further down the line, the medical particular book says if the age of the couple is greater than 35 and they are unable to conceive in 6 months of trying, then they should be treated as infertile. So if you are less than 35, you get a window of 1 year as per the book. If you are greater than 35, you get a window of only 6 months to conceive. Otherwise, you are treated as infertile. Now, this is bookish knowledge. I totally don't count to this. For me, it's case to case basis, and definitely I try to increase this window based on the each case. And you as a doctor who are looking into this presentation, I request you also to do the same rather than totally sticking to the bookish knowledge. Further down the line, if I see the infertility in a man, although this shows that among the 10 couples, there are 4 couples who not conceive only because of the infertility in a man. But nowadays, I could say this can also be extended to one more particular man, and it can be 50-50. So whenever the question of infertility comes, the major of the stigma goes to the woman, but that is not the case. The overall study shows that the infertility also exists in a man equally. And when any couple approaches me, I always advise to do a test of both of them and check infertility in both of them. My next slide, as we are moving towards the end, what food should you avoid? The first and foremost is the alcohol. Alcohol is a major cause which results in infertility more in a man rather than a woman. I would prefer a woman drinking alcohol a little bit, but I will not prefer a man drinking the alcohol, because it is found that the alcohol results in a lot of infertility in a man rather than a woman. The food that might contain listeria. Now, listeria basically deals with, or it hinders the particular endocrine system. As such, any particular food that is containing this needs to be avoided. Most of them are soft ripened cheese, so all the cheese products as far as possible needs to be avoided. Then we have camembert, some goat's cheese. So all sort of these particular cheese products which are rich in contents of listeria needs to be avoided. Blue wing cheese like Danish Blue and Stilton. I'm not criticizing any of these particular names, but roughly based on experience, as the people have more tendency towards going for a dairy product and a cheese eating, that may also result in increase in the weight of the body. And once the body weight increases, definitely there are very high chances of gaining infertility. As such, avoiding this kind of products is always better when you are decided to conceive. The next particular thing is the sources of vitamin A. Basically, excess of vitamin A is bad. So what are the sources? One is the liver products, which many a times in many religions have found that they do prefer eating the dishes made of the liver. So to some extent, I would recommend is to have a little bit less consumption of it, because it may also affect your fertility. And so does is the red meat. You can eat eggs instead of it, and you can also eat the chicken, and fish is always anytime preferred if available. Rather than a 10 particular fish, try to go for a natural fish from the river or the sea. You can also eat eggs, you can also eat the chicken, but try to avoid the red meat and the liver products. And the last and foremost is the caffeine. Many times you have a tendency to have a high intake of the caffeine, but caffeine and alcohol are major particular problems also associated with infertility in both men as well as the woman. Now, having seen, so I have just listed down some of the foods. It doesn't mean that only these foods you should avoid. There are also other particular foods which also needs to be avoided, but these are one of the major ones that I've highlighted. Also try to avoid the carbonated drinks and avoid more sugary products. Avoid more sugary products. So reduce the intake of your sugar consumption. Now, what are the food and practices to follow? The first and foremost is try to have organic food. Try to have organic vegetables. If you want to have the egg, try to have the particular egg from an organic poultry farm. You can have the organic chicken from that particular poultry rather than the particular chicken which is induced with the steroids. Because again, any particular food that has the steroid particular part associated with it, definitely it is found to affect the fertility. The next one is try to have as much as possible of the anti-inflammatory foods, like try to include turmeric, the ginger, the fresh ginger I'm talking about, is in your food. So try to increase their particular consumption as much as possible. Eat a bigger breakfast. Now, many times I've found that we eat a lot of heavier lunch, heavier dinner, rather than, I would say, eat a bigger breakfast. A simple example I would like to give you is whenever you start a particular car and when you are in lower gears, your car consumes maximum amount of gas. That's what also happens with our body. When we get up from our sleep, that is a time when all your particular body parts gets activated and they require a lot of energy to sustain. Because when you are sleeping, most of them are shut down. But when you wake up, suddenly all the parts gets activated and they are looking for a lot of energy from your particular body. As such, having a bigger breakfast will always settle up with that particular problem. And further, try to always break your meals into smaller sections rather than having a heavier lunch or heavier particular dinner. Avoid trans fats. So as much as possible, try to avoid the vegetable oils and fatty foods because that will result in increase in your weight and increase the obesity. Cut down on carbohydrates as much as possible. Eat more fiber in terms of fresh vegetables, veg fruits, and so on. The cereals and all you can eat. The swap protein sources. So always try to also take a protein particular diet. Get active. Don't be idle. Always try to go for a walk. Always try to go in a gym, and always try to keep your body as fit as possible. Because the more active you are, more active will be your endocrine system, and definitely more fertile you will become. Take enough rest. This is also very important. A minimal sleep of 6 to 7 hours is a must for a couple if you are planning to conceive. So a good amount of rest also helps in stimulating your endocrine system, and that is a must. Achieve a healthy weight. So try to always keep track of your weight and also try to find out your height and try to compute the body mass index ratio or BMI index, what we call. And if it is within a permissible limit, then nothing to worry about it. But if it is higher, then definitely you need to work out on your weight because the height is ultimately cannot be changed after some years of age. So definitely the component that is adjustable becomes a weight, and always try to maintain a healthy weight. And that can be definitely maintained through by being active and by consuming the right food. And of course, also try to increase your iron intake. This is basically for the woman because usually it's been observed that the women are more anemic because of her menses and menses. They tend to lose a particular blood, and as such, I also observed they are more anemic and their iron content drops down. As such, the hemoglobin levels also drops down. As such, I always recommend to particular always have a good intake of this. So with this, I end up my presentation. These are the particular places where you can reach me. You can reach me on Facebook with Stanwin Diets. On my Facebook group, I have a particular group, Dr. Stanwin and Dr. Stavin, or gynecologist. And again, one more group you can associate it with me is Dr. Gynecologist. And on WhatsApp, once you join this group, you can also group one more group of mine on WhatsApp as well. Thank you for listening to me. Very soon I will come up with the other presentation. So have a nice day.